Prof, a very good morning to you and thank you very much for your time. I want to touch on the area that did not get a mention from the President, but of course it's quite controversial. In fact, it is in court as we speak, and that's the area of the sale of tobacco. What did you advise?
Well, we never gave any advice about tobacco. So I think that the decision to prohibit the sale of tobacco was taken not by scientists. We know that tobacco is bad for your lungs, and we know that people shouldn't smoke. So there are health risks associated with smoking, and there are some benefits of not being a smoker.
Mm-hmm. But your individual opinion then on this, what would you advise government to do? You've already said this was a decision by government, but I'm trying to get your personal thoughts on the matter.
Well, I think that the issue is that cigarettes are widely available on the illegally, and they come at a huge price. And if households are using their scarce resources to buy cigarettes instead of buying food, I think that's a problem. So I think that we have to find pragmatic ways to solve the issues. We also know that nicotine is a huge addiction, and we have to find ways of preventing that addiction. So it's such a powerful addiction that people will do anything to smoke. Yeah. And so we have to have an understanding. If we are going to prohibit the sale of tobacco, one should make alternative arrangements for people who are nicotine addicts.
Yeah. Prof, then let's move on to the area of education. It is still a major area of concern. It is a big talking point. A case is actually going to be heard in court today. Is the MAC, which is the advisory committee that you are in, are you steadfast that schools should remain open despite the alarming rates of infections that we currently face?
Well, I'm talking in my personal opinion now, and also as a pediatrician. And so I would support that schools should remain open, and that we know that the younger you are, the less you are at risk of getting bad disease or being hospitalized. And so we know where our risks are. And the job is to keep our teachers who are old or who have comorbidities safe. And so schools should remain open. We should also implement non-pharmaceutical interventions at schools, which means that we have to make sure that the schools are clean, that people are washing their hands or sanitizing their hands, they're wearing masks, and that they are implementing physical distance. We also have to make sure that we know in our schools which teachers are old, the age of the teachers, as well as their comorbidity, so we can protect them. So the whole idea of easing the lockdown and opening up the country is to use the non-pharmaceutical interventions that we have to maximize the slowing down the spread of the virus. And so we should make sure that wherever we go, whether it's school or places of worship or the mall, that we implement non-pharmaceutical interventions. They're the most powerful tools to prevent the onward transmission of the virus. And so wherever we are, whether it's a school or a place of gathering, those are our tools to protect the onward transmission. Prof, and so schools should remain open.
Yeah, it's such a contentious area, this whole issue around schools, Prof. I just had a conversation with Musumaimane, who was speaking to me about the younger children who have been said by pediatricians that they will not be as infectious if they do contract the disease or the virus, and the symptoms are not going to be as severe. But what about schools that are of the age perhaps at 12 and above? We're talking teenagers. Is that age group infectious, particularly for those that live with parents who have comorbidities?
So we also know that we live in intergenerational households, and that children who go to school may live in households with older parents with comorbidities. But we still have to make sure that even in a household, you're implementing your non-pharmaceutical interventions. You're making sure that your hands are washed. So when children come back from school, they need to wash their hands. They need to not touch their faces, and they need to make sure that they prevent the onward propagation wherever you are, whether you're at a school or anywhere else. So we know the data. We know that children and younger people are less affected than older people with COVID. And we need to keep our schools open. Children need food. We've heard over the weekend that children are being deprived of a meal a day, and they're also being deprived of an education. And so we need to look at the most pragmatic way to manage this epidemic. This epidemic is going to be with us for many months until next year, and so we can't not have the schools open. We can't not have children being fed. And we need to understand, and we know what we have to do to prevent the onward transmission, and we have to continue to implement them, wearing masks, not always washing your hands, not touching your face, and making sure the surfaces wherever you are clean, and learn to work in an epidemic and make sure that our children thrive, they get fed, and they get educated.
Two key areas that I want to explore with you quickly, Prof, before the time ends between us. One, the area of hotspots. What stringent regulations should apply there? And I'm asking you this question with government's proposal for a differentiated approach when it comes to hotspots.
So I think the most important thing about a hotspot is knowing where it is and working with communities that are in the hotspot to minimize transmission. And so what you have to do is, the moment you identify a hotspot, is to do community engagement and talk to people in the community to manage the onward transmission. And again, if you're in a hotspot, it's very important that you implement again your non-pharmaceutical interventions and work with communities so that they're engaged and that they understand. Every citizen, it's not just the government that has to do the work, it's the citizens, it's the community, it's our church leaders. Everybody has to work together to prevent the onward transmission of the virus. And so if there is a community that's in a hotspot, very important things to start engaging with the community, explaining to the community the issues, and getting a social compact between the community and the leaders to ensure that we try and limit the onward propagation of this virus.
Professor Gray, healthcare workers are a major source of concern right now, and so are hospitals in handling the spike. As a country, are we ready for the coming spike?
The healthcare workers need PPE, and we must make sure that every healthcare worker, wherever they are, has access to the appropriate PPE to protect them as they manage and care for people who have COVID. We have spent a lot of time during the lockdown to try and make our hospitals as ready as they can. You have to remember we had a fragile health system at the beginning of the epidemic, and so we hopefully that the hospitals are ready and that we have all the support that we have. This is going to be a tough epidemic, and it's going to be very hard to manage once all the provinces start to surge. And we hope that the
What do you mean hard to manage, Prof?
Well, I think what I'm saying is that we already know that we had a fragile health system to start off with. And we also know that we also have a paucity of human resources in the health system. And so we have to have all hands on deck. We have to have our hospitals ready, and we have to make sure that we can try and manage. We need a public-private partnership. We need to make sure we're working with the private sector in order to respond to this. Remember that no country has had all the expertise, all the facilities, and all the support. Every health system, no matter how whether you're in the US or whether you've been in the UK, all the health systems have buckled under COVID, and so we can't expect not to have the same kind of problems that have been seen elsewhere in the world with more resources. And so all the countries' health systems have buckled under COVID, and so we can't expect not to buckle when our counterparts in high resourced areas in the world also had huge strains on their health system.
Prof, let's end this conversation on a tantalizing note, if you like. How's the relationship, or how's the climate inside the MAC, and by extension its relationship with government since the public disagreement?
The MAC is full of high competent and wonderful scientists that are dedicated to help the government and support the government to contain this epidemic. And so everybody's objective is to find ways to minimize the impact that COVID has on our country. And so the advice we give, we hope, is seen to be in that area, in that we are trying to help and support the government in their response to the COVID epidemic.
Professor Glenda Gray, thank you very much.